Take the policeman at the school crossing. He's a pretty good symbol of our concern for the safety and welfare of our children as they travel along this perilous journey we call growing up. Of course, many other people are concerned with the health of our children. The private physician and dentist, the health officer and the school nurse, the school counselor, and certainly the teacher with whom the child spends so much of his time. And you can think of others. But when you come right down to it, the continuing supervision of the child's health is primarily the job of his parents. After all, he's your child, and it's your responsibility to help him make his journey in health. Good health means a state of feeling well in body, mind, and spirit, and a sense of... Oh, Martha, I'm not a speaker, I'm a doctor. What makes him think I could make him a good talk?
Lots of them have heard you in your office, in their homes.
Well, that's different when I'm talking to one family. But up there on that platform, trying to make all those people see the importance of continuing health supervision of... Well, that's rough.
Would it help to forget about all those people and just think about one child?
What do you mean?
I mean a specific youngster, and what it would mean to that boy or girl.
Well, I could certainly think about little Judy Bemis. Anyone who saw her, as I did this afternoon, would understand right away why it's so important for a child's health supervision to begin at birth and continue on regular schedule.
Well?
You know, the first time I laid eyes on her was in the office, several weeks ago. She was a sweet little thing, a real picture of health, until she walked. Judy was 3 years old, and this was the first time she had ever been taken to see a doctor. Her mother told me they had, of course, noticed her trouble as soon as she started to walk, and even before. But they just assumed that she was born deformed and that there was nothing to be done about it. So they did nothing, until a visiting nurse saw the child and persuaded the mother to see a doctor. The case looked pretty clear, and X-rays confirmed a congenital dislocation of the hip. At 3 years of age, this meant surgery and many months of living in a cast. That's the way I saw Judy this afternoon. The pity of it is that if her mother had followed a program of regular, periodic checkups, the difficulty would have been detected much earlier, and correction might have been as simple as having her sleep with a pillow between her legs. Or if surgery had been necessary, well, living in a cast doesn't interfere with the physical and emotional development of an infant as it does with a 3 or 4 year old. Of course, in such a case, I believe most parents would have taken upon themselves to seek medical aid much sooner. But there are other things less obvious that early diagnosis and treatment... No, it'll sound like I'm up there trying to drum up business.
I suppose some people may take that attitude. But after all, dear, they invited you to come and talk. I should think that the only thing you can do is to present the facts as you know them.
Well, just the same, I wish they had chosen someone else to... Well, I'll get it.
Probably one of your patients going to drag you away from the joys of speech writing.
Hello? Oh, yes, Mr. Morton. Tommy? Yes, I'd better. Why don't you bring him over here to the office? Yes, this evening. Fine. And don't worry, Mr. Morton. Oh, about 10 or 15 minutes. Good. Goodbye.
What happened to Tommy Morton?
He cut himself, and his father wants me to check him. Say, maybe that's an idea for my speech. You know, the physician is still in the business of treating people when they're ill or injured. But these days, a good deal of our time is given over to preventive medicine. And it's a good thing, too. You asked me to think about specific children. Well, I can recall when Tommy made his last visit to the office for his regular checkup. I remember because Tommy made quite a pronouncement.
Dr. Fowler, I've decided I'm too big now to undress every time I come to your office.
Well, you are growing up. There's no doubt about that.
I sure am.
Well, Tommy, let me ask you something. If you wanted to check on the engine of your car, wouldn't you have to look under the hood?
Well, maybe
Wouldn't you?
I suppose so.
There's no set pattern for a health examination. Every physician develops his own method and procedure. The important thing is that the examination be thorough, a complete study of the child's growth and development, his total fitness. Well, it looks like you're feeding him all right, Mrs. Morton.
Oh, he eats.
All right, let's check those feet, Tommy. All right, now make a muscle for me.
Why?
Well, I want to check all your parts, and I want to see how these parts fit together into that machine called Tommy. Bend over and touch your toes. Okay. You know, Tommy, how an airplane pilot has millions of gauges and things in front of him to tell him how well his airplane's working?
Yeah.
Well, he has other ways of knowing, too. He can tell by the sound of the engines and by the feel of the plane. Hop up here. He can tell by how well the plane banks and climbs and turns, by how well it behaves, just generally. And you know, it's much the same way with the doctor. He's had a lot of experience with human machines, some that are running well and some that are beginning to cause trouble. And like a pilot, he gets to be pretty good in spotting trouble in lots of ways. Mm-hmm.
Find something, Captain?
Well, there's a gland here, seems a little too big. We'll check the nose and throat to see what's happening. But right now, I want to see how the machine responds to the controls. You see, Tommy, you make a lot of movements without really thinking about them. When you walk, when you eat.
Or swat a baseball.
Right. If the reflexes aren't normal, it's a sign there may be a disturbance in the spinal cord or the nervous system. Well, let's see how that lazy eye is coming along.
Oh, the eye doctor says it's not lazy anymore.
You know, it's a good thing we found that lazy eye when you were little, and that your eye doctor made it wake up and go to work. If your folks hadn't been looking out for your health, and that eye had gone until now without being detected, chances are it would have been too late, and you'd be going through life with one weak eye.
It's okay now, isn't it?
Yep, those muscles are much stronger now. We'll check it on the chart before you go. All right, now let's see the mouth.
There's nothing wrong with his talking.
So I've noticed. How long is it since he's seen his dentist?
Well, he is overdue for a visit, but, oh, it's just so hard to fit things into a schedule that, well, you know, so many things.
Yes, I know. There are some spots here that seem to need some care. I'd take him to a dentist pretty quick. Now, Tommy, open up a mile and pant like a dog.
Like this?
That's it. Yes, the right side of that throat does look a little red. That may account for the gland. Has he had a fever in the last couple of days?
Why, no. At least not that I've known anything about.
Has your throat been hurting, Tommy?
Nope.
Oh, then it's probably something mild. But just to make sure there's no infection to worry about, we'll take a throat culture and do a blood count on you before you go.
Now you're going to listen to the engine.
That's exactly what I'm going to do. To listen to the engine, to see that all parts of this human machine are working properly and growing properly. That's the reason for regular periodic examinations. But it goes deeper than that, because this is a human machine. We're concerned not only with his physical growth, but with the total development of the whole person. So, all during the examination, I'm observing other things about him. The way he talks, his responses to things I say, his reactions to things I do, his interest in what's going on, his total relationship with me. These things measure his emotional development, much the way the sphygmomanometer measures his blood pressure. Or the chart measures his vision.
Hey.
All right. Now, Mrs. Morton, before he goes back to school, take him to the ophthalmologist for a regular check, would you?
We were planning on that, Dr. Fowler.
Oh, fine. Miss Carlisle, Tommy's going to need a throat culture and a blood count. Tommy, would you go with Miss Carlisle, and she'll tickle your throat, and she'll prick your finger and take out just one little drop of blood, all right?
I guess I could spare it.
And then I'll give you your booster shot.
Oh, don't you have to have a shot again?
Now, Tommy.
Oh, all right. But not my throwing arm.
It's a deal, son.
All right, Tommy, you get dressed and meet me in the lab.
Well, Mrs. Morton, it looks like you're doing a fine job with that boy.
We try. Oh, I'd like you to make the notes in our health record of Tommy.
Okay. Yes, he's developing well, physically and emotionally. Anything you'd like to discuss with me? Any problems?
No, nothing special. Is this gland something to worry about?
Oh, I don't think so. Unless something shows up in our tests. If it doesn't go down in a day or two, give me a call, will you?
I certainly will.
I'll expect to see him again next year. Oh, are you back already?
Sure, nothing to it. What's that?
Well, Tommy, both your parents and I keep a record of how you're doing in this business of growing up. It's sort of a running story on you right from the beginning. Young man, let's get that shot over with, shall we?
Okay. No, that's my pitching arm. I guess you know an awful lot about me, don't you?
Well, that's my business. Your parents and I and your school working with us. You see, your teachers have to know a lot about you, too, so they can do their best for you. And their observations of you, day in and day out, are mighty important in helping keep track of the way you grow up and the adjustments you make.
The what?
He means the kind of a man that you're growing up to be. How you treat other people and how you take things that happen to you. The good things and the bad things.
You mean like being a good winner and a good loser, too?
That's right. Here, catch.
What's this for?
You said you were a good catcher, and I just wanted to try you out. By the way, how's your sister Kate?
All right, I guess. You ought to know. You're the doctor.
Yes, I ought to know.
Goodbye, Dr. Fowler.
Goodbye.
So long, Dr. Fowler.
Yes, I ought to know about his sister. Let's see. Kate was 4 years old last April. 4 years old, and I've been seeing her regularly since the day she was born. The first years are the most important for the early detection of possible difficulties. That's why I recommend that parents take their children to a physician on a regular schedule. During the first year, every 4 to 6 weeks. During the second year, every 3 months. From age 2 to 6, every 6 to 12 months. After that, once a year. Parents sometimes comment that this is a pretty full schedule. But we generally have our automobiles checked over regularly. And most of us think children are even more precious. The physical examination of a 4-year-old is much the same as for an older child. But what we call the interview is quite different. Techniques vary, but our objective is to test the child's emotional development. The child who performs the tests for his or her age level and does it freely and smilingly, this child, we know, is, generally speaking, making a successful adaptation to the world and to the family in which he or she is growing up. We also learn a great deal about how successfully the family is adapting to the child. Sometimes we see a child who frets and fusses and resists the little game we play. Of course, one such experience tells us very little. But if we've been seeing the child regularly, and we know he has the ability to perform the tests, but still doesn't, then we look for the cause. Does Fred object to, getting up in a barber chair?
Oh, he puts up an awful fuss. Yes, he does.
Does he sometimes put up an awful fuss at home, too?
Oh, yes. His father says, well, yes, he does.
I see. Well, Mrs. Blake, you know, when a child exhibits such a resistance to adults, it may mean that somewhere he's being pushed beyond his capacity. I wonder if you or your husband aren't expecting Fred at the age of 4 to conduct himself in ways that belong to a child, say, of 6.
Oh, I don't think so. Of course, he is 4, and he should be making some progress towards maturity.
Yeah.
And he actually wants to read. So I have been helping him with a few words. And, well, but I couldn't say we're pushing the boy.
Counseling with parents on a child's emotional needs is every bit as important as counseling with them on diet and exercise and other physical needs. But parents so often shy away from discussing behavior problems.
Is that because they're less tangible, more difficult to work with?
Possibly. Of course, there's no way of drawing a line between physical health and emotional health. The case history we develop out of regular visits, though, is often a very valuable guide. I'm thinking of the case of Susan Worth. Susan entered 2nd grade this year, and soon after school opened, she started being the funny girl in class. Of course, health supervision of children is a three-way responsibility, shared by parents, physician, and school. Observing Susan, her teacher was puzzled, because all through 1st grade, the child had been well-behaved and had done better than average work. When Susan's mother brought her to me for examination, I was puzzled too. Susan was one of my regulars. I'd known her from infancy, and she seemed to be developing normally and making satisfactory adjustments along the way. Clearly, something new had come into the picture. A complete examination revealed no physical impairment. But when I started talking with her about school, she said she didn't like it, didn't want to go anymore, and wasn't going to go anymore. I gave her a few simple arithmetic problems at her level, and she had no trouble whatever solving them. Then I printed a few words that she ought to know and asked her to read them to me.
3, cat, light, walk.
Here was that something new about Susan. In 2nd grade, she was being called upon to do more reading, and our full diagnosis revealed her problem to be what we call dyslexia, or word blindness. Her behavior, then, was her way of fighting back, of compensating for her inability to see words as well as the other children could. Once this was known, her parents were able to take it up with the school and work out a solution to the problem. Now, Martha, I don't want my audience to get the impression that every child may be developing a physical or emotional disorder. If I can just get my point across by stirring up an active concern without spreading alarm, I better step over and open the office for Tommy and his father. All right, Tommy, let's hop up here on this table, shall we? Attaboy. Sit down, Dad.
Thank you, Doctor.
Now, tell me, how'd you cut this finger?
Well, I was helping Dad straighten up the garage, and you know the kinds of shears you use for cutting flowers and things?
Things like fingers?
Yeah, fingers.
Well, young man, I never want to hear any more complaints out of you about having your booster shots, because this is one of the reasons for having that protection.
Didn't protect me from cutting my finger.
No, but if you had seen the boy who came into my office a week or so ago, he punctured his hand with a wire. He had never had any shots, but his parents thought that because the wire was clean, there was no danger. Then the wound healed up by itself.
But you said he came to your office.
That's right. And now, quite a bit later, he complained that his neck was stiff. By the time they brought him to my office, he had lockjaw. You know what that means?
Like this?
That's right. That boy had a painful time of it, and he'll be a long while getting well.
Gee.
So you'll be glad to get another little booster shot now, won't you? Just to be on the safe side?
Sure, go ahead. Just as long as my finger's okay by Saturday.
Oh, are you catching a game?
The big one.
You know, Tommy, you have your parents to thank for that. If they hadn't made it their business to keep checking up on your health, whether you seem to need it or not, we might not have caught that lazy eye in time. Steady now. And if that eye had grown up weak, you might have missed out on baseball and some of the other things you're going to want to use your eyes for. Now, let me see that finger.
Well, I sure want you to keep checking me every year.
Fine, Tommy.
Every year? For how long?
Till you're through high school, anyway. As a matter of fact, Tommy, you never outgrow your need to look after your health. Isn't that right, Dad?
You bet.
Okay, son. All fixed.
And thanks a lot, Doctor, for taking time out of a busy evening to look after Tom.
You're entirely welcome.
Yeah, thanks a lot. Why don't you come out to the game Saturday?
Say, I might just do that, too.
Thank you, Doc. Good night.
Good night.
Hey, Tom. All right, Tommy. I guess you'll be in shape for the game.
Sure, I'm in good shape. But, Dad,
Yes?
how long since you had a checkup?